about these group of drugs we are going to see in this PowerPoint. The first group of drugs are incretins, incretin mimics. So, to understand about these group of drugs, we should know about incretins. Incretins are the substances which are produced from our intestine in response to glucose or nutrients. When we ingest or when we take glucose or any other nutrients, immediately these incretins are released from our small intestine. There are two primary incretins. First one is glucose dependent insulinotropic peptide, which is called as GIP, and another one is glucagon-like peptide, GLP-1. GIP as well as GLP-1. These are the two incretins which are released in our intestine. So, both of them they get released by ingestion of glucose. The main action of these incretins are they stimulate the pancreatic cells to secrete the insulin secretion. When food is taken, these incretins are released in our stomach and immediately they releases the insulin secretion. They have got effect on beta cells, proliferative effect on beta cells, reduces the apoptosis and increases the efficiency of the beta cells. Even though these two incretins are there, we prefer GLP-1 analog than GIP, glucose dependent insulinotropic peptide. Why means the main reason is this GIP, they enhances the postprandial glucagon response. That means after meals, it increases the glucagon secretion. If glucagon is secreted means naturally that will increases the blood sugar level. So, the required effect what we are aiming for won't be obtained. So, we are going to therapeutically we are using this GLP-1 group of drugs. So, we are concentrating on this GLP-1 incretin, and the analogs agonists of this GLP-1 is commonly used in the form of drugs. So, glucagon-like peptide, GLP-1 analogs. They are secreted from L cells of distal ileum as well as colon, and their main action is they stimulate the secretion of insulin and they reduce hyperglycemia. They increase the glucose-dependent insulin secretion and improve the insulin sensitivity and increases the beta cell mass and its efficiency. These are the main action of these incretins released from our body. And they suppresses the glucose-dependent glucagon, that is glucagon secretion, as well as it slows the gastric emptying. It has got blocking the gastric emptying action so that the fullness of stomach can be maintained and reduction of food intake and limits postprandial hyperglycemia. So, these are the advantages of this GLP-1 incretin which is secreted in our body. So, how this GLP-1 is secreted and how it produces the action. When oral glucose is ingested in the small intestine, this GIP as well as GLP-1, these incretins are produced. These incretins, they acts on the pancreas to secrete the insulin. It acts on the pancreas to secrete the insulin and decreases the glucagon secretion. And in the brain, it produces a satiety as well as decreases the appetite. That is, a feeling of fullness, a feeling of enoughness is produced and decreases the appetite. And in the stomach, it reduces the gastric emptying. That means slows down the digestion process. And in the liver, it increases the glycemic control and decreases the lipid production. So, these are the effects produced by this incretins, GIP as well as GLP-1, which is released in small intestine when oral glucose, when we are taking food or any other nutrients. So, this is the process takes place in our body. But the problem is this active GIP, GLP-1, they have got very short TF. So, GLP-1 has got a TF of around 5 minutes only. Immediately, this incretins are degraded by an enzyme called dipeptidyl peptidase 4 into inactive GIP as well as GLP-1. So, these incretins, if it is present in our body, it has got so much of advantageous, meritorious effects in our body. But these incretins are digested immediately by this DPP4, dipeptidyl peptidase 4 enzyme to inactive GIP as well as GLP. So, if it has become inactive means all this positive effects we are missing. We have found two groups of drugs to treat this condition. One is by inhibiting this DPP4. By inhibiting this enzyme, we can increase the GIP and GLP-1 level. This is the first group of drugs. The second group of drugs are the drugs which are otherwise called as GLP-1 analogs. We are giving GLP-1 agonist synthetic drugs, exenatide, liraglutide, these group of drugs, so that it will produce us all these positive effects. And another advantage is the synthetic drugs what we are giving, they are resistant to DPP4. So, they are not a substrate for dipeptidyl peptidase 4 enzyme. They are not metabolized by this enzyme. So, it can produce us all the positive effects. It can increase the insulin secretion, increases the satiety, decreases the gastric emptying. All these effects can be produced by this GLP-1 analogs. So, two groups of drugs, GLP-1 analogs and DPP4 inhibitors are the two groups of newer drugs which are used in diabetes.